But Anne is a 36-year-old woman who's been in a relationship with Sam for the past 5 years. They report that they're sexual with each other about 1 to 2 times per month. They do say that the frequency of their sex has declined since the beginning of their relationship, but they do report that they are both satisfied and find the sex to be mutually enjoyable and pleasurable. Anne does report some vaginal dryness at the beginning of sex and says that it takes her a while for her mind and body to get into it. She is sometimes able to orgasm with oral sex, but is not able to orgasm with intercourse. So based on this description of Anne, I'd like to pose the question of, is Anne sexually healthy? And this question and other questions such as what is sexual health, how do we know if someone is sexually healthy, what is a typical sexual response, these are all questions that have been posed by researchers throughout the decades, including researchers such as Masters and Johnson. Some of you may have seen the show Masters of Sex, which is a TV series put out by Showtime, and chronicles the life and work of Masters and Johnson, who were sex researchers who started their work in the 1950s. And for those of you who've seen the show, you know that Masters and Johnson invited people into their lab to have sex and monitored people's physical and body responses as they were having sex. Now, based on the work of Masters and Johnson and others who followed, the traditional model of sexual response was developed. Now, the traditional model of sexual response says that at the beginning of a sexual experience, someone feels desire. So by desire, I mean an urge or a want to be sexual. And as someone is sexual, they experience arousal. So for women, for example, women might experience genital swelling or lubrication. Arousal becomes more and more and more until orgasm is reached. And then there's this resolution phase during which the body returns to its non-aroused baseline state. So we can see from this model, it's very linear, it's very one-directional, there's a clear start and a finish. And if we're looking at Anne from this perspective, Anne may be viewed as not very sexually healthy. She's not necessarily experiencing an orgasm every time she's sexual. She's not necessarily experiencing desire and arousal at the beginning of her sexual experience. And in fact, when this model was applied and women were asked about their sexual experiences, large numbers of women were saying, this doesn't fit with my sexual experience, and those women were considered to have sexual problems. And in fact, in our work now, we've moved away from the traditional model of sexual response and adopt what we call the circular model of sexual response. This model of sexual response was developed by Dr. Rosemary Basson, who's a Vancouver-based physician and sexual medicine expert. And based on Dr. Basson's experience working with large numbers of women and couples and hearing their stories, she developed this circular model of sexual response. Now, this model does say that spontaneous desire can and does play a role in women's sexual experiences. So by spontaneous desire, I mean that want or that urge to be sexual, what we saw at the beginning of the traditional model of sexual response. So for women, spontaneous desire is often present in the beginning of a relationship or in shorter-term relationships where novelty and excitement are high. But more commonly, women will report that they have many different reasons for being sexual. And research out of Texas actually asked men and women what their reasons were for having sex. And this research came up with 237 different reasons why people are sexual. So anything from feeling attracted to a partner or loving a partner to wanting to seek revenge. So a huge range of reasons for being sexual, and clearly there's a lot of different motivations to be sexual. That if a woman is motivated and willing to be sexual, then there's some kind of sexual stimulation that's needed. So for example, this could be sexual touch that feels good. And the mind needs to be able to process what's happening and be able to process the touch and the stimulation that the woman is receiving. And it's then that arousal occurs, both physical arousal in the body and mental arousal in the mind. After arousal is experienced, that's when women are often reporting, now I feel desire. So that's what we call responsive desire. It's desire in response to arousal. And this model says that If the sexual experience has been positive for the women, then there's a sense of satisfaction that results. So this can be both physical satisfaction or emotional satisfaction or both. So it is important to recognize that for many women who report being sexually satisfied, they're not necessarily experiencing an orgasm. And let's imagine now that Anne has been experiencing genital pain for the past 3 months. So she's reporting a burning, stabbing, raw pain when she has penetration. Now, Anne has gone to her gynecologist and she has been diagnosed with provoked vestibulodynia, or PVD. So we'll take a look at the sexual response model and what happens with Anne now that she has genital pain. She's experiencing pain, having thoughts such as, this pain is awful, I don't know if I'll be able to handle the pain. And even if Anne is not experiencing pain yet when she's being sexual, she's not able to focus on what's happening in the experience because she's having a lot of worries and anxieties about, is the pain going to be present? What if the pain comes? Will it be excruciating? I won't be able to handle it. So Anne's not experiencing arousal. She's not experiencing responsive desire. And the result of her sexual experiences with pain is that she's left feeling very deeply dissatisfied. And in fact, she's having really negative thoughts such as, there's something wrong with me, I'm a sexual failure, I'm broken, I'm sexually substandard. So we wanted to touch on sexual health and genital pain today in order to help you understand what the impact of genital pain is on a woman's sexual health. If you are a woman who is suffering with genital pain yourself, often understanding the impact that the pain is having is the first step to starting to restore sexual health and working towards minimizing the impact of the pain on your life.